Hi, Dr. Pelto here. I want to go over a few questions that I've received recently from patients. This question came from a patient. How do I treat calcifications in the Achilles tendon? And let me show you a picture here. This is an example of an X-ray, and you see these little white dots that are here. Well, if you look at the outline here, this is the Achilles tendon. And occasionally there can be either bone spurs or these little white dots. In this specific patient, this patient was seen by another specialist, a rheumatologist, that was giving cortisone injections into the Achilles. Now, we don't tend to do this anymore because it can cause certain issues. It can cause rupture of the Achilles. But regardless, occasionally when you inject tissue, such as in the plantar fascia or I guess in the Achilles, it can create little, almost like calcifications inside of there, and it can be caused by other things as well. It could be the bone spur in the back that kind of busts off, or something else like that. But with these calcifications or the hardening inside of the tendon, I want to explain a little bit about the anatomy. So when there is little micro tears or injury, that could be from a needle going in, could be from injection that was done. That can cause changes in little hardening inside of the area of the Achilles tendon. That would be a tendinitis, can be a tendinosis. You can see it a little bit better with an ultrasound. How would you treat it? In my opinion, I like to use my Achilles tendinitis treatment evaluator. This helps me to explain how to treat it to patients. I don't want to go in depth with everything, but specifically if there's calcifications, I would use Shockwave treatment in there, and I would potentially use an amnio injection based on the ultrasound. Certainly prior to that, you could do home therapy, physical therapy, deep tissue massage, changing things like that. But if there is pain due to those calcifications in there, I think Shockwave is going to work best. Let me explain a little bit about Shockwave. There is something called radial and something called focused Shockwave. To really get into the bone, the focus is going to be a little bit better. The radial is good just to loosen up all the tissue. It's not going to break up that bone, but it's going to help it to heal, and it's going to heal any of the areas of inflammation in it. Okay. This is an example of the device. You would use it on the back of the Achilles region. I would do between 3 and 6 sessions of the Shockwave. If you want to know how it works, this is kind of the technical slide. I put here pain scale 5 to 8, because if the pain is really, really bad, you can't really tolerate it. But if it's not all that bad, you could tolerate it, and it works with all of these effects of the Shockwave. So you can learn by reading about it. I'm going to put a link to another video that I have on Achilles tendinitis if you want to learn that. And as well, there was a webinar we did on Shockwave if you want to learn more about that. Okay. Once again, please subscribe to this channel. Put any other questions that you have underneath this video, and I will try to answer and get back to you about that. Okay. Thanks, guys. Until next time.